Hi everybody, my name is Dr. Bibi Ghalaie. I'm a cosmetic physician here in London, and I'm very excited to be here today with Glow Day to tell you all about tear trough fillers, which is one of my areas of expertise and one of the most popular treatments that I carry out in my clinic. So the first question is whether tear trough fillers are safe, and it's a very important question because, as we know, aesthetics is a very unregulated industry. So tear trough fillers are incredibly safe if they are carried out in expert hands and in somebody who has competence in this procedure. The best advice I can give you is to make sure that you go and see a medic if you're having this procedure done, and also somebody who carries out tear trough fillers regularly. And by that I mean somebody who's actually carrying out the procedure multiple times a week, not just kind of once a week or once a month, but someone who does this procedure regularly and can tell you about their complication rates and how effective their procedures have been, and can show you a range of clinical cases that they've done demonstrating the effectiveness and things that can go wrong, things that can go right. So yes, they are incredibly safe in expert hands. How long does it take for tear trough fillers to settle? Well, it takes about 10 to 14 days from the time of the procedure. The result is instantaneous, but it usually needs about 2 weeks to settle. How are tear trough fillers done? So tear trough fillers are done using various techniques. Some clinicians use a needle, some clinicians use a cannula, some clinicians use a combination of the two. My procedure, I call it the no needle technique because I make a puncture using a needle near the cheek, and then there's no needle involved in the procedure at all, which actually makes the procedure much more safe because there's a lot less trauma or damage to the skin, the underlying structures, including the vessels, the soft tissues, the muscles, the fat. So that's how I do my technique. How much do tear trough fillers cost? Well, it really depends on who you're seeing and where you're seeing them. This procedure varies in cost according to different areas of the country. In London, you can expect to pay anything from £400 up to £900. At my clinic, the starting price for this procedure is £650. Which filler is best for tear trough procedures? This is a very important question. So in the UK, there's actually only one dermal filler which is licensed for use in the tear trough, and that is Teoxane's Redensity 2. That's the only filler that actually carries the license, and that is the filler that I use for this procedure, and in my opinion, it is the best filler for this indication. However, you will see different clinicians using different types of fillers. As long as it's a hyaluronic acid filler, it would be considered safe. However, the results are different according to which filler is used, and that's something that every patient should be discussing with their injector before they go ahead. Should you be having tear trough fillers? Well, that really depends. It depends on your face, it depends on the area under the eyes, the tear trough, and it really depends on how much hollowness there is, and whether there's any puffiness or what we call fat pad herniation, which is when there's kind of an outpouching of the fatty tissue under the eye, and also the looseness or the crepiness of the skin is very relevant to this procedure. So it's really something that's very dependent on the individual. The best advice I can give in this regard is to have a consultation with an experienced injector and discuss with them whether they think the procedure would be appropriate for you. I always look at photographs before I ask the patient to come in, and then I'll take time to assess the face and see whether this is an appropriate procedure before I go ahead. Can tear trough fillers move? Yes, they absolutely can, unfortunately. Tear trough fillers can migrate to other parts of the face. They can move downwards, they can move sideways, they can even move upwards, and unfortunately they can also move more superficially and cause a protrusion. So it's really important for the patient to be followed up closely and for a review to take place 2 weeks after the procedure to ensure that everything is stable and that a good result has been achieved. Can tear trough fillers cause blindness? So The short answer to this question is yes, they can, and I always consent for blindness when I'm carrying out this procedure. But in all honesty, the risk is really minimal. So actually, if you look at the evidence of the cases of blindness that have been caused by dermal fillers worldwide, the most common procedure that causes that is fillers in the glabella or here in the middle of the brow, followed by nasolabial fold fillers, so smile line fillers, and nasal fillers, non-surgical rhinoplasty, and then tear trough filler comes much further down the line in terms of the frequency of blindness. So yes, it can cause blindness, but actually in competent hands, it's a very safe procedure, especially if done with a cannula. Do tear trough fillers hurt? The all-time important question. No, they do not hurt. They shouldn't be painful. It's not a painful procedure. It can be a little uncomfortable. There can be some tugging and pulling on the skin. Certainly at the start when the needle is introduced, yeah, that's a little bit of a sting, but it's not a painful procedure. And in fact, if it's painful, something's not quite right. So you should be very weary if you're having the procedure done and it's painful. In fact, you should tell your injector that you're experiencing pain, because there shouldn't be any pain during this procedure. Can you treat tear troughs without filler? This is an interesting topic. It's difficult to get a really good rejuvenation of the tear troughs without filler. However, there are other treatments such as PRP, such as radiofrequency, which can help to tighten the tissues in the tear trough and can help to benefit that area. But in my opinion, treating under eye hollowness with dermal fillers is the gold standard for rejuvenating the under eye area. What is tear trough filler? Tear trough filler really is hyaluronic acid that is injected into the under eye area, so in this area here, and it helps to improve hollowness and to some extent shadowing of the under eye, and to help fill that area and to rejuvenate it. Certain types of fillers that we use have other things added to them which can actually help to repair the under eye skin as well as just filling it. Who can do tear trough fillers? So there's a lot of debate around this topic, particularly because aesthetics is a really underregulated branch of medicine, and there are a lot of non-medics performing these procedures. I feel very, very strongly that only medics should be carrying out tear trough fillers. And by medics, I mean doctors, dentists, nurse prescribers, and pharmacists who are prescribers, and midwives who are prescribers. If someone doesn't have prescribing rights, they shouldn't be carrying out these procedures for safety reasons, simply because then they cannot prescribe the medication that might be needed to dissolve the procedure should it go wrong. So I feel very strongly that only medical professionals should be carrying out these procedures to keep patients safe and for us to help us keep industry standards high. Can tear trough fillers cause headaches? They shouldn't really be causing headaches. So if someone's developing a headache as a result of tear trough fillers, that should be a warning sign to the injector and to the patient that something may not be right. Sometimes people might experience a headache after the procedure or the next day as a secondary after effect, but an ongoing headache or a headache kind of, several days down the line, that shouldn't be happening at all. Can they go lumpy? Good question. So they shouldn't go lumpy. Your doctor, your dentist, your injector should be checking for lumps after the procedure, and if there are any lumps, they should be smoothed out. There certainly shouldn't be any filler at a superficial level, and if there's any protrusion of the filler, so if you can actually see it and if it looks lumpy, that means that the filler has been placed too superficially. So then you would need to go back and see your injector and discuss what to do next. Probably the filler needs to be dissolved. So no, they shouldn't be lumpy. There should be a nice smooth continuation from here, from the under eye area down towards the mid cheek. How do you know if tear trough fillers have gone wrong? It's really important to be able to recognize the signs. So if there's significant bruising, particularly if the bruising is spreading, if there's significant pain, if there's lumpiness or you can see the filler, if the filler looks like it's moved, and also if there's any change at all in the vision. These are all signs that something's not quite right. And definitely these things should be addressed immediately by your aesthetic practitioner. Where is the tear trough area? The tear trough area is this area here. So it extends from just under the lower eyelid towards the mid cheek. And in some people, you'll see a hollowness that extends from here all the way down towards this area of the face. So it's really the kind of infraorbital or under eye area that we're talking about, and particularly hollowness in that area that we're trying to address with tear trough fillers. Are tear trough fillers halal? That's an important question for Muslim patients, and actually there isn't anything in the hyaluronic acid that's used for tear trough fillers that's animal based. So in terms of whether it's an acceptable product to be used by a Muslim, yes it is. There's nothing in there that's kind of would be considered non-halal, but whether the procedure itself would be acceptable in the religion of Islam, that's a whole nother topic, and one that I will leave to the individual to discuss, to decide themselves and to discuss with their practitioner. I hope you've found this useful. I'm happy to answer any further questions that may come up. If you'd like to leave questions under the video, I'm more than happy to answer them by DM, and so will the team at Ghalaie.